Welcome back to our show, Obesity Care with Dr. Kanica Yashi. As always, I'm your host, Manal, and I'm so glad you've joined us again for this episode. Today, we're going to talk about the impact of obesity on your physical and mental health. And today, we're not only joined by Dr. Yashi, we actually have two special guests today. First of all, I would like to introduce Dr. Kanica Yashi. She's an internal medicine and obesity medicine specialist, and I hope you know her by now. So today we have two special guests, actually. I would like to introduce Dr. Abigail Quintos. She is a board-certified and practicing physician in the fields of pulmonary, critical care, and sleep medicine. She works in a teaching hospital in upstate New York. Whether in the clinic, ICU, or the sleep laboratory, Dr. Quintos sees overweight or obese patients every day and can share her experience and expertise on how obesity affects someone's lung and sleep health. Secondly, I would like to introduce Dr. Jaswinder Work, who is a renowned cardiologist and an educator working at Cooperstown, New York. Dr. Work is keenly involved with training fellows at the Cardiology Fellowship Program at his hospital. So viewers, let's welcome them together. Hello, everyone. How is everyone doing?
Hi, Meenal. Thanks for having me. So excited to be here today. Thank you.
Of course.
Also, likewise, very happy to be here and join you on this episode.
Thank you, everyone. I'm honored to be here to have the stage with my colleagues and educate the public about this very important issue.
So I would like to begin by asking Dr. Yashi, how has obesity impacted people's physical health?
Right, Meenal. So obesity can impact a person's physical life or have an impact on their mental, psychological, social, or even economic issues for that matter. But in terms of chronic conditions, and just to list a few, I'd like to say that those who suffer from obesity, they have a chance of having high blood pressure 67% more than a normal person. Chances of suffering from stroke for people who are obese is 64% higher than for normal people. Chances of having heart disease is 50 times higher. Chances of suffering from type 2 diabetes is 20 times higher. And let's not forget the effects of mental health that people suffer from being obese or carrying that excess weight. Just to give a statistics, people who suffer from obesity have a 55% chance of suffering from depression. And these are just a few that I listed, and the list just goes on.
Right. Yes, it's really scary how obesity can affect so many parts of your life. And the heart is especially an important one. So I would like to ask Dr. Work, since he's the cardiologist, what effects can being obese have on your heart?
Well, that's a very important relationship between obesity and heart disease. We all know heart disease is the leading cause of death in the United States and also worldwide. And obesity is a major risk factor. Not only does it deliver and determine the straight heart disease, it also impacts and worsens all the other risk factors. So obesity will increase risk factors such as hypertension. It'll make diabetes even worse controlled. Also add to the heart disease such as coronary artery disease. And in layman terms, coronary artery disease is basically the cholesterol deposition and the fundamental for what is called as a heart attack. Moreover, obesity is a major determinant of other electrical disorders of the heart, such as atrial fibrillation. Atrial fibrillation will make your heart rate go fast and can also cause strokes. And when we talk about treatment of atrial fibrillation, the number one thing that American College of Cardiology recommends is actually weight loss. So even before all the medications and procedures, losing weight goes a long way to treat heart disease. And thirdly, I want to say obesity as a major driving factor for heart failure. Heart failure is a major reason for hospital readmissions, has a burden on our community, and obesity is causing there's different types of heart failure, and obesity is the cornerstone of being the main problem in that. So I just want to say through this platform that obesity causes all types of heart disease and is a very important risk factor to control.
So do you have any suggestions or precautions for people to avoid having these conditions?
So yes, I mean, obviously Dr. Yashi has talked about how we can control our dietary habits and lose weight. So it will directly impact obesity and control those risk factors. However, there are certain things that can be done. For example, controlling other risk factors such as hypertension, controlling other risk factors such as cigarette smoking or tobacco abuse can go a long way to reduce the overall burden for heart disease. And through this episode, I want to also educate people about the signs and symptoms that they should be aware of so that they can recognize heart disease at an early stage. So when we're talking about coronary artery disease, they should be aware of any symptoms that limit their activity, any chest pressure or tightness that comes with activity, so that they can be proactive and seek out medical care.
Right. So I picked up on something you said. Tobacco smoking increases your chances, of having the heart disease. And these days, a lot of people are using the vape pens or different kind of vapes. Does it have the same effect as well?
Yes, and Dr. Quintos is our expert who will add more on that. And actually, vaping is just as much, if not more, dangerous than cigarette smoking. So through this medium, we should raise an awareness about how the advertisement that focuses on the young age group in our community and may even popularize this type of product use, but this is equally dangerous.
I know that smoking already has a big effect on your lungs. And so I would like to bring conversation to you, Dr. Quintos. How does being obese affect your lungs?
Sure. So there's several things that how we can relate obesity with lung health. I chose to pick out at least 3 that are probably more commonly associated to lung and sleep health. Number 1, just to touch a bit on obstructive sleep apnea. It is a disease entity wherein you stop breathing during sleep. And during those times that you stop breathing, your oxygen levels drop, sending signals to your brain to wake up. You have these multiple arousals in the middle of sleep. And so you wake up feeling tired, still sleepy, and feeling like you didn't get any rest at night. So that usually manifests as daytime sleepiness, very poor quality sleep. So in that sense, you get poor quality sleep from, having obesity and overweight as your risk factor. That's number 1. Second is an entity called obesity hypoventilation syndrome. So when someone is obese and overweight, that extra weight and increased chest wall limits the lung from expanding to its full potential. So then someone hypoventilates, meaning they breathe lesser volume of air as you would normally do. So that may present as you're just short of breath all the time during the day. And more so, the carbon dioxide, which is a bad gas that builds up in your body, is eventually going to be toxic and reach toxic levels for your brain. And, that's something that needs to be treated with advanced measures such as a sleep apnea machine or a CPAP machine, or sometimes even more advanced called a home non-invasive ventilator. So that's the second thing that I see very usually in either the clinic or the hospital. Lastly, a very common presentation or manifestation and effect of obesity and being overweight and your lungs are patients presenting as if they have asthma-like symptoms. So this is quite common. I see patients in the pulmonary clinic, very short of breath, and then they get started on inhaler or puffer medications to treat what is usually mislabeled as asthma. But it's usually related to the inflammatory effects of being overweight and obese to the lungs. And what we found is that with subsequent weight loss, they may come off, or usually they do come off their inhaler medications if that was the initial cause. So in those three lung conditions and sleep conditions, I could say that obesity has quite such an impact on. Scratch that last sentence. I'll do a summary sentence now. Lastly, with the examples that I just gave, these are just three more common presentations and impacts of obesity and being overweight to your lung and sleep health.
So, Dr. Quintos, what advice do you have for people to prevent these issues besides weight loss?
Yes, good question. Of course, primarily, weight loss is a very good part as a solution to these things. But other things you could do for your lung health, number one, I always encourage my patients to increase their physical activity. Particularly for lung health, I actually encourage yoga or controlled and focused deep breathing exercises. It makes you more cognizant and in tune with your breathing, so that it becomes more of a natural habit for you to take deep breaths instead of smaller, very shallow breaths. So yoga breathing has in fact been related to improvement in patients who have asthma and COPD. That's number one, apart from weight loss. Secondly, for those who have obstructive sleep apnea, as you're working towards weight loss, right, it's also very important to see a clinician if you're really suffering from the symptoms of it, of daytime sleepiness and poor quality health, because there are ways to help you through it and sleep better. Why would that be important? So treatments such as CPAP therapy could get you through treatment of sleep apnea. It treats sleep apnea. And as you work on weight loss, you're getting better quality sleep. Once you improve the quality of your sleep, weight loss efforts become much more successful, and that, you have better control of your hunger hormones. And that's been proven clinically and very much so in research studies. Those are two. Lastly, of course, this is just to reiterate, and everyone knows about this too, but cigarette smoking. If you can cut back or quit from cigarette smoking or the like, any type of smoke that goes down your airways could cause irritation.
Right. So I liked how you mentioned that it all matters if you're breathing. The first step is like breathing deep, taking deep breaths and fixing your breathing. So for our viewers, if you're interested, you have apps like Calm app, these apps really help you with practicing meditation and just just taking a few seconds from your day and just focusing on breathing. So I think that's a good start. Now I would like to move on to the mental health aspect of obesity. And I want to pose this question. It's open for everyone to answer. We know that being obese can impact mental health negatively. What do you guys have to say about that?
So obesity definitely has a lot of negative impact on a person's mental health. In my practice, when I see obesity, I see a lot of depression, anxiety, mood disorders, body image issues associated with it. I have also observed a lot of financial issues that are associated with obesity. For example, a person may not be getting a job that they'd like, or being not promoted as they would like, relationship issues, marriage issues, friendship issues, and things like that. And these problems are not only present in adults, but are also seen equally in kids when they are in school, in their younger age groups, or at home as well. But the problem gets worse as you get older.
Right. What do you think, Dr. Virk?
Yes, like Dr. Yashi mentioned, the obesity is very commonly seen associated with mood disorders. And it's important to note that both obesity, as I mentioned, is a risk factor for heart disease, and depression is another risk factor for heart disease. So there is a lot of vicious cycles that go into play, and it's like a domino effect. One risk factor further activates 4 other risk factors, and then it's a downfall. So we have to start taking it piece by piece, start solving it one problem at a time, and try to get a handle on this.
Right. And I just remember how Dr. Quintos mentioned that if you have sleeping issues, that just made me think of how then you are going to have mood changes and you're going to be irritated throughout the day. And so can you tell how that can affect your mental health, Dr. Quintos?
All right. So with regard to poor sleep quality and how that affects your mental health, first of all, it's not all about lack of sleep. It's also whether you're getting quality sleep. So whether if you are getting 8 or 10 hours of sleep, but if it's poor quality in that you stop breathing during sleep because of sleep apnea, your oxygen levels drop during sleep, then you still wake up very tired, unable to focus during the day. All that goes into how functional you could be during the day, and that could certainly affect your mood. You're very quickly irritable. You don't have patience to get through your activities.
So, Dr. Yashi, you talked about how obesity can affect your relationships, your friendships, a lot of other things. And you said as you get older, it gets worse. Why do you think that is the case?
Yeah, I think one big reason is that obesity is associated with a lot of anti-obesity stigma and discrimination. Many people who are obese perceive or kind of feel that they are repeatedly being treated poorly or unfairly due to their excess weight, whether it's at work or home or school. And this thought process actually backfires, and it doesn't help people learn to lead healthier lives in terms of eating better or exercising. It just makes them feel very bad about themselves. So one thing would be to become increasingly aware as a society, but also as healthcare providers who are in this field, to become aware of their implicit and explicit biases for people who have excess weight and learn ways and mechanisms to counter those attitudes. So that is one reason. The second reason I feel is that people who are obese, as I have mentioned earlier, have this risk factor of developing chronic diseases, and much earlier in their lives, like hypertension, that is elevated blood pressures or diabetes or heart issues. And having all these issues certainly doesn't help them. It really can impact their morale to lead better lives. So it is like a catch-22 situation.
Yes. So as you said, it is a catch-22 situation where being obese, people have these mental disorders, but having these disorders doesn't help them lead a healthier life. So in this case, are there any psychological conditions that can lead to obesity?
So that's actually a great question. There are quite a few eating disorders that are out there, and I see them fairly commonly that can put on a lot of weight. For example, the most common ones I see are binge eating disorders or night eating syndrome. Binge eating disorder is an issue where people eat large amounts of food until they are uncomfortably full. So they do not have a sense as to when to stop. Night eating syndrome is when people wake up multiple times at night to snack or to eat, which can help them fall back asleep. So when I suspect these disorders in my patients who I'm treating for obesity, I typically refer them to a psychologist or a psychiatrist who's expert in treating these eating disorders.
To add to what Dr. Yashi had mentioned, I'd like to also talk a bit on what is called sleep-related eating disorder. So it is a type of parasomnia, meaning it's actually something happening while you're asleep. So you're not aware of it, but you're eating in the middle of the night. The difference from what she had mentioned, the others, which is binge eating or nighttime eating syndromes, is that usually people eat odd type of food, and whether, for example, a stick of butter. And then they're completely unaware. They may wake up surrounded by crumbs of food in their bed. So that's another eating disorder, or again, a parasomnia that occurs during sleep that someone has to be treated for differently, that could cause or lead to weight gain and obesity.
I just want to summarize that. So as you can understand from all this conversation, that how important it is to screen somebody for eating disorders itself before just saying that we need to fix somebody's diet or, exercise, which are also obviously important, but these people can have a lot of eating disorder issues to begin with. So as healthcare providers, we should be cognizant about screening for them, or at least getting a eating history or a diet history from a person or a patient when we are beginning to treat them for obesity related issues.
Right. And I'm pretty sure our viewers are interested in this topic and they are learning. And I would like to ask our panelists if any last thoughts or words they have, or any tips they have for the viewers who are struggling from obesity and its related diseases and complications.
From the lung standpoint, I would just like to end with, being overweight and obese can cause a lot of shortness of breath and physical debility on someone's breathing. It can cause mobility issues. It can cause poor sleep in the form of untreated obstructive sleep apnea. And like I had mentioned earlier, there are many ways to try to overcome this apart from weight loss, such as deep breathing exercises and cutting back on anything toxic to your lungs. And I'd like to stress on those things.
Yes, I would like to say we've already mentioned how obesity is such a major risk factor, both for heart and lung disease and for the mental health. So the important point here is that with weight loss, we see improvement. And it's important for our patients to know that sometimes it's only 5 to 10% of body weight loss is enough to show significant improvement in both heart and lung disease. So we need to have smaller but more consistent goals as we are going through this journey.
I just want to say to our viewers that mental health is essential to physical health. If you think that you or your loved ones are suffering from depression, anxiety, mood disorders, or eating disorder, or any other psychological issues, please seek help. So have the mental disorder treated first or along with being treated for obesity.
So please stay tuned for our next episode because I'm sure it'll be a really good one. I hope you guys enjoyed today's episode. As always, I'm your host, Manal, and you're watching Obesity Care with Dr. Kanica Yashi. Please don't forget to watch our show on MANATV International's YouTube channel. Please subscribe to our YouTube page and follow us on Facebook. I'll see you next week.